This lecture will focus on the abnormalities of temperature regulation. First one is pyrexia, which in common language is called fever, and it refers to increased body temperature above normal. Pyrexia is caused by the toxic substances which can affect temperature regulating centers. So, when I say that they affect the centers, it means that in this condition there is a resetting of the set point to a higher level. There could be many causes of fever, among which few are important, such as bacterial and viral infections, as you all know, and then certain environmental conditions and brain tumors, they can also result in pyrexia. Now we will focus on the mechanism which is responsible for the genesis of fever. uh, in fact, there is a resetting of the hypothalamic temperature regulation center by the pyrogens. Now, these pyrogens, they are the substances which can raise the hypothalamic set point above normal. And these include not only the certain bacterial viral proteins, but also the breakdown products of proteins. And in addition to that, sometimes the lipopolysaccharide toxins which are released from the bacterial cell wall, they also act as the pyrogens. Ultimately, these pyrogens, they raise the set point. And when the hypothalamic set point that is raised, then all the mechanisms to raise the body temperature, they become active as well. In this figure, you can see the mechanism of the action of these pyrogens. You see that the pyrogens, either they act directly on the hypothalamic center, or they act indirectly via the cytokines, especially the interleukin 1. What actually happens, that there are bacterial breakdown products which are phagocytosed by the leukocytes and the macrophages, and then the cytokines, they are released. And the cytokines, especially the interleukin 1, that is released by the phagocytic cells, and this interleukin 1, it induces the formation of prostaglandin E2. Now, this prostaglandin E2, it acts on the hypothalamus to cause the fever reaction. And you must be familiar with the term antipyretics. Now, these antipyretics, they are the drugs which decrease the formation of this prostaglandin E2. For example, aspirin. And this is how they reduce fever. Now, in this figure, you can see that there are two unique features, or you can say two phases of the febrile conditions. Uh, First one is the chills, and the second one, that is called crisis or flush. Now, when the set point that is raised, then the phase of chills that start, in which shivering and vasoconstriction that results into chills in an attempt to raise the body temperature up to the new hypothalamic set point. As far as the second phase is concerned, when the pyrogen that is removed and the set point that is brought back to normal, then all the body mechanisms to lose heat, like sweating and vasodilation, they become active, and as a result of which the body temperature that is brought back to normal. So, next one is hyperpyrexia, which is a fever of above 41 and a half degree centigrade to, or you can say in Fahrenheit, it is around 106 to 107 degree Fahrenheit. And it is seen in severe infections or in case of hemorrhage in the central nervous system. Now, a similar sounding condition is hyperthermia, but keep in mind that it differs from hyperpyrexia because in hyperthermia, the set point it remains unchanged. So that's why this condition it does not respond to antipyretics. Then there are different types, or you can say different forms of hyperthermia, such as heat stroke, or it could be drug induced, such as amphetamine or cocaine induced, and it could be malignant hyperthermia also, which is an inherited genetic abnormality in the calcium release in skeletal muscles, where increased release of calcium it turns on the muscle contractions and excessive heat generation. And sometimes this malignant hyperthermia this is also triggered by some anesthetic agents such as halothane. Let's look at the disorders due to increased environmental heat. And in order of increasing severity, these disorders could be heat syncope or heat cramps. And then I will give you a brief view of heat exhaustion and heat stroke. There could be a university question to differentiate between heat exhaustion and heat stroke. So let's first move on to heat syncope. Uh, this could be due to history of vigorous physical activity for a couple of hours. Mainly, it results from cutaneous vasodilation, which could result in cerebral and systemic hypotension, leading to syncope. Treatment options of heat syncope include rest in a cool place and fluids given by mouth. Now, what are heat cramps? Due to excessive salts loss in sweat, painful heat cramps they may occur, which of course because they are due to the loss of salts. So these cramps they are relieved by salts, the sodium chloride replacement, and also by the cold environment. Now we next one is heat exhaustion. Uh, this is due to the excessive loss of salts and water, and this excessive loss that leads to hemoconcentration, which will result in hypovolemia and hypotension, of course. And the other symptoms, they could be headache, vertigo, nausea, and ultimately the patient collapses because there is less blood supply to the brain. In this exhausting condition, skin is cold and clammy, and the temperature could be normal or subnormal. Treatment options may include the recumbent position of the patient, and the patient should be removed to a cold place and should be given salt and water replacements. Next one is heat stroke, which occurs due to failed compensation. And keep in mind that this is a life threatening emergency which damages the hypothalamus. And actually, what happens is that the core temperature, it rises to a point that the hypothalamus, it ceases to function. And a very peculiar sign of heat stroke is the absence of sweating. In heat stroke, the body temperature, it may rise up to 105 to 108 degree Fahrenheit, and there is definitely a failure of all the heat dissipating mechanisms. Usually, heat stroke, it occurs during heat wave when the temperature and the humidity, that is very high. Symptoms of heat stroke may include hot and dry skin, dizziness, abdominal distress, vomiting, delirium, loss of reflexes, a loss of consciousness, circulatory shock, hyperpyrexia, and even death could occur due to neuronal damage or renal failure or even myocardial infarction. Now, this heat stroke, this could be of two types. It could either be exertional or non exertional. You see, as the name is indicating, the exertional heat stroke that occurs by exercising at elevated ambient temperatures and elevated humidity. And what could precipitate this condition is dehydration, or if someone is taking medications, because in case of dry environment and at maximal efficiency, sweating can dissipate around 600 kilocalories per hour, but it requires the production of more than 1 liter of sweat. So you can see that how dehydration can aggravate the condition. Now, the non-exertional type of heat stroke typically occurs in either young or elderly individuals, particularly during the heat waves. Now, more vulnerable uh, patients are the elderly or the bedridden patients, or the patients which are taking say anticholinergic drugs or anti-Parkinsonian drugs, or they are taking diuretics which cause dehydration. And then the individuals which are confined to poorly ventilated and non-air conditioned environments, they are also susceptible to develop this heat stroke. Coming toward the treatment option of heat stroke, they may include the cold sponging or the alcohol swabs, even the ice immersion. This could be very good idea, and of course, salt infusion, that is recommended. Sometimes even skin massage is used to increase the blood flow to get rid of excessive body heat. Now, I want you guys to grab a paper and a pen and make a column of differentiation between the heat stroke and heat exhaustion on the basis of their causative conditions, their symptoms, and how do we manage the two conditions separately. I already told you that the cause of heat stroke is the inadequacy, or you can say the failure of heat loss mechanisms. While in case of heat exhaustion, the cause mainly is the excessive fluid loss, which leads to hypovolemia. Then there are certain warning signs. In case of heat stroke, these signs could be headache, weakness, and loss of consciousness. While in exhaustion, the weakness is usually gradual, and a very particular sign is the excessive sweating and anxiety, nausea, and even syncope. So, when we look at the symptoms, especially the appearance of skin, in case of heat stroke, the skin is hot and dry with almost no or very little sweating. And the pulse is usually full, mean bounding and rapid pulse, and the temperature is very high, usually more than 40 degree centigrade. If we talk about the exhaustion, then the skin looks pale grayish and clammy, and the pulse is very weak and slow. Also there is low blood pressure, and if we talk about the temperature, then temperature is moderately raised, and usually it is less than 40 degree centigrade. Now the management is also different in case of stroke or and exhaustion. So what do we do in heat stroke? There should be emergency cooling of the patient by wrapping or immersion in the cool water. Even ice packs, they could be used over the head, in axilla or in groin. And the patient should immediately be evacuated to the hospital because it's a life-threatening condition. While in case of exhaustion, the patient should be placed in a recumbent position with his or her feet elevated, and water and salts should be replaced orally. Rarely intravenous replacement is required. Now we will see that how human body reacts when it is exposed to extreme cold. So, in extreme degrees of low temperature, unless treated immediately, a person exposed to, say, ice water for 20 to 30 minutes ordinarily dies, either as a result of heart standstill or the cardiac fibrillation, because by that time the internal body temperature, it would have fallen to about 77 degree Fahrenheit. But if the patient is warmed rapidly by the application of external heat, then the person's life, it can often be saved. Now, why there are such dramatic effects of extreme cold on the human body? That basically is due to the loss of the temperature regulation at the low temperatures. Because the hypothalamic temperature regulation, it is impaired when the body temperature it falls to around 94 degree Fahrenheit, and it is completely lost when the body temperature it falls to around 85 degree Fahrenheit. uh, so how does it happen systematically that there is a twofold decrease in the cellular metabolic rate for each 10 degree fall in the temperature? And then comes the depression of the central nervous system, and this depression it ensures sleepiness and the loss of shivering. Loss of shivering means there is no production of heat, and finally at the 77 degree Fahrenheit there is cardiac standstill. So let's see uh, what is hypothermia. This could be defined as a decrease in the body temperature below 35 degrees centigrade or 95 degree Fahrenheit. An alternative definition could be that hypothermia it's a clinical state of subnormal body temperature when body fails to produce enough heat to maintain the normal activities, and elderly they are more susceptible to hypothermia. Now this impairment of the metabolic activities, this is considered a peculiar setback of hypothermia, which becomes fatal when the temperature drops below 31 degree centigrade. If we have to classify hypothermia, it could be mild, moderate, and severe. When body temperature falls to 35 degree or a maximum of 33 degree centigrade, this hypothermia is considered mild, and the patient shows uncontrolled intense shivering, and his or her body movements they become ill coordinated, and this chillness it causes pain and discomfort. Now when the temperature falls to around 33, 32, or 31 degrees centigrade, then the this hypothermia that is labeled moderate. In this case, shivering now slows down or even it stops, but the muscles they become stiff, and patient shows mental confusion and apathy. Respiration becomes shallow, which is followed by drowsiness. And the other symptoms of this degree of hypothermia is a weak pulse and low blood pressure. Now, the hypothermia it becomes severe when the body temperature falls below 31 degrees centigrade, and there is a peculiar skin presentation that it becomes chilled and bluish gray, and there is a gradual loss of consciousness and a gradual deterioration of vitals. Now, hypothermia can also be seen in patients of certain diseases such as myxedema or Addison's disease, hypoglycemia. But the common features of hypothermia are shallow breathing, bradycardia, hypotension, loss of consciousness, and sometimes arrhythmias also. Apart from the you can say the environmental exposure, there are certain other risk factors also for the development of hypothermia, and These risk factors are extremes of age, that elderly and neonates they are more vulnerable to develop hypothermia. Then there could be some toxicological or pharmacological um agents such as ethanol, which you are familiar with, and even barbiturates or anesthetics, antidepressants, they can cause hypothermia. Even simple insufficient body fuels in case of malnutrition, they can make the person susceptible to hypothermia. And then there could be medical conditions which could be endocrine related or even neurologic related. And hypothermia is also observed when multiple systems of our body they starts failing in case of trauma or sepsis or shock. Apart from the hypothermia affecting the whole body, there could be a localized presentation of hypothermia also, one of which is chilblains, which in medical terminology is called perniosis. Typical feature of perniosis is the irritation and ulceration of local patches of skin and redness and swelling of digits. Treatment options involve to wear socks and gloves, and sometimes immersion in warm saline may be needed. Certain drugs could be prescribed to treat chilblains, and the drugs include steroids, antihistamines, and certain vasodilators. Next, localized presentation of hypothermia is frostbite, which is a term which you might have heard in some mountaineer based movies. Uh, Frostbite occurs when the body is exposed to extremely low temperatures. In other words, the surface area of the body it can freeze upon exposure to cold, and this phenomenon is called frostbite. Now the question is that how does this frostbite it could result in permanent damage. Actually, what happens that the ice crystals they develop in the bloodstream or even inside the cells, causing permanent circulatory and tissue damage. And even upon thawing, gangrene develops, and the area it has to be removed surgically. Frostbite occurs especially in the lobes of the ears and digits of hands and feet. Now, this figure shows the classification of frostbite. It could be superficial or deep, or you can classify frostbite into first, second, or third degree frostbite. Uh, in first degree frostbite, there is only a slight irritation of skin, while in second degree, blisters they appear in the skin, but there is no major damage. But in third degree frostbite, this involves all the layers of skin and it causes permanent tissue damage. Now, in this figure, you can see that how pathophysiological changes they occur in frostbite, and how the ice crystals which are formed in the bloodstream and inside the cells, they damage the vascular endothelium, and ultimately that results in uh, tissue ischemia and skin necrosis. You see, once the crystals are formed, they damage the blood vessels, which will result in the stickiness of blood, that will cause the stasis of the blood flow, and very tiny thrombi are formed. And wherever these thrombi they block the vessels in the skin, they cause then dermal ischemia, and that results in frostbite. Luckily, there is a phenomenon of cold induced vasodilation, which provides natural protection against frostbite. Now, this mechanism it helps prevent frostbite by delivering warm blood to the skin. But unluckily, the mechanism is far less developed in humans. Now, in Arctic animals, in which this protective mechanism is very well developed, what happens that when the temperature of the tissues it falls almost to freezing, the vascular smooth muscles they become paralyzed due to extreme cold, and because of this paralysis, sudden vasodilation occurs, which is manifested by the flush of the skin. Now, this vasodilation it leads to the improved blood supply to the tissues, and it helps against the frostbite. Sometimes hypothermia could be used for medical science advantage also, such as the artificial hypothermia, in which the temperature of a person is decreased by the use of ice or cooling blankets until the temperature falls. Now, this temperature can be maintained below 90 degrees Fahrenheit for several days to a week or more by continual sprinkling of cool water or alcohol on the body. It is easy to decrease the temperature by first administering strong sedatives which reduce the reactivity of hypothalamic center. Now, what is the use of this artificial hypothermia? You see, heart surgery can be done after hypothermia, so that heart can be stopped artificially for minutes at a time. But keep in mind that cooling to this extent, it doesn't cause tissue damage. As a matter of fact, this hypothermia, it decreases whole body metabolic rate by approximately 8%, and as a result of which not only the oxygen demand diminishes but also oxygen consumption in tissues that is reduced. Now, this low metabolic rate it allows aerobic metabolism to continue during the periods of compromised oxygen supply, and body cells they can survive 30 minutes to more than 1 hours without blood flow during a surgical procedure. Another example of artificial hypothermia is the cryopreservation, which is basically suspending life due to freezing. But only certain cell types they can be cryopreserved, such as semen or special cells of blood for the transfusions. Also, stem cells they can be cryopreserved. Then there are tissue samples like tumors or histological cross sections. Even human eggs or human embryos, which are 2, 4, or 8 cells, they can also be cryopreserved.